Hi, I'm Andy Sergent. This is my senior capstone project for NUR 433, Wilmington University. The community I selected is Dover, Delaware, with a zip code of 19901. I live outside of Dover, but I've worked in Dover almost all of my life. This is a picture of the city of Dover. It is a city of approximately 37,500 people. It encompasses 22.7 square miles. The median income for household in the city of Dover is $38,669, and the median income for a family is $48,338. The per capita income for the city was $19,445. Approximately 11.5% of the families and 13.8% of the population are below the poverty line. 19.6 of those are under age 18 and 10.4 of those are over 65 years of age. The dimension characteristic, the two that I chose, one was location and time and space. The town of Dover has evolved, advanced, and declined over time. Dover has been in existence since 1683. It has a rich history and is centrally located within Delaware. The second dimension is social system. Excuse me. The members of this community, city officials, community watch groups, police, fire, ambulance, etc., they all intertwine and collaborate to facilitate organization and common goal setting. These factors are what is needed to advocate for positive social change, which in turn creates a healthier community. Identify two community needs and issues and one community asset. Social determinants are in part responsible for the unequal and avoidable differences in health status within and between communities. The selection of social determinants as a leading health topic recognizes the critical role of home, school, workplace, neighborhood, and community in improving health. Safer community areas for exercise and physical activity was my first community need. It falls under the LHIF neighborhood and built environment. The second is violence and crime prevention, LHI of injury and violence prevention. Community asset. Dover has a really good school system. So high quality education is afforded to every student enrolled in the Capital School District. They have 7 elementary schools, 2 middle schools, 1 high school, Kent County Community School, which has 3 satellite schools, and that's for severely learning disabled, developmentally delayed, autism spectrum, and handicapped students. Of the schools in the Capital School District, 3 have been built or remodeled within the past 10 years. DHS, Dover High, is only 3 years old and is a state-of-the-art educational facility, housing about 1,900 students. Early College High School at Delaware State and Campus Community are both charter schools. Parkway Academy Charter School and Kent County Secondary Interactive Learning Center are for students that cannot be matriculated in with general school population due to behavior issues or anger management. Dover, Delaware. The school average test scores in Dover are 12% lower than the national average. There are approximately 20 schools in Dover, public schools in Dover. 83.6% of the people in Dover have completed 8th grade. 82.4% of the people in Dover have completed high school. 28.4% of the people in Dover have completed a bachelor's degree. It says that they have a student-to-teacher ratio of 13:1. Delaware has 16:1, and the national standard or the national average is 16:1. I can verify that as an Exploring Health Sciences teacher in Central Middle School in the Capital School District, that 13:1 is not true. I taught Exploring Health Sciences for 2 years, and they have me with 33 students by contract, 6 classes a day. That's 198 students per day for 18 weeks. I get a whole nother batch of students the following 18 weeks. So that's another 198 students that I would see. 33:1. And that's the average in that school. The Leading health indicator for education is AH51. It says to increase the proportion of students who graduate with a regular diploma 4 years after starting 9th grade. Health area vibes gives them a grade for education of a D+. It's not very good. The students have a really, really tough time meeting those standards. State 2 community needs or diagnoses. Support your diagnosis with data findings and Healthy People 2020 Social Determinants Framework. The 5 key determinants, as stated by healthypeople.gov, are economic stability, education, social and community context, health and healthcare, neighborhood and built environment. Community needs diagnoses, my first one, is increased risk of obesity among youth and adolescents related to the decline of safe areas for exercise and physical activity as demonstrated by current obesity statistics. The second needs diagnosis is increased risk of injury among adults related to violence as demonstrated by the Dover Police Department crime rate statistics. And then it says to develop a community health plan to address one community need. So I selected places to exercise safely. Dover has several parks for families to utilize. However, they are not always in safe areas. Dover needs a park where there are lots of activities for all age groups, has well-kept facilities and security. The city of Dover is in one of the most serious violent crime eras it has ever seen. The crime rate in Dover is increasing each month. Dover has had a 14.7% increase in violent crimes, which include murder, homicide, forcible rape, robbery, and aggravated assault. From 2015 to 2016, it was a 14.7% increase. Excuse me. The overall crime rate is 89% higher than the average crimes committed in Delaware. It is also 111% higher than the national average. So it's not a great place to live and go to school when people are getting shot and stabbed every day on certain streets that these children live on. And they have no place. These parks are located within those areas, and it's just not safe to be out there. The 5 key determinants by healthypeople.gov are economic stability, education, social and community context, health and healthcare, neighborhood and built environment. The determinant for this community need is neighborhood and built environment. An assessment study will assist in program development by identifying areas of need and the resources that may be used in a community development plan. Planning consists of prioritization of needs that require intervention and the levels of prevention necessary for the aggregate population. The plan should include what is available now and what is needed for the future, what you have and what you need. Community involvement is the first step in planning any community park or recreation area. The community needs to recognize the necessity of a community-based center and or park and the benefits to all the people, a buy-in, so to speak. Assessment of local needs and resources can assist in the research and planning of a community park. A community-led study or survey will supply the most accurate information. Collaboration groups such as planning and implementation will assist in developing objectives, approaches, and goals with a plan of action. These collaboration groups would consist of community officials, school board members, local business members, health services personnel, and parents/community members. A diverse group of people is needed during this phase so that all aspects are considered equally. A community health plan for safer recreational areas would involve the City of Dover officials and Capitol Police Departments, Capitol School District officials, as well as Delaware Health and Social Services, DHSS, which is a state-level stakeholder. The purpose of DHSS is to improve the quality of life for Delaware citizens by promoting health and well-being, fostering self-sufficiency, and protecting vulnerable populations. DHSS states their goal as maximizing personal and family independence to become a self-correcting organization that works to keep pace with changing client needs and a changing service delivery environment. They have 12 separate divisions within its department: Aging and Adults with Disabilities, Child Support Services, Delaware Health Care Commission, Developmental Disability Services, Long-Term Care Residence Protection, Management Services, Medicaid and Medical Assistance, Public Health, Social Services, State Service Centers, Substance Abuse and Mental Health, and Visually Impaired. DHSS covers almost every aspect of most community health issues. It has individual departments that specialize in particular needs for all demographic areas within the city of Dover and the state of Delaware. The Division of Public Health, DPH, would be the most beneficial agency for enhancing and or creating a safer recreational area for the community. DPH has 11 departments within its agency that focuses on the needs of the community. The following would assist in the research and implementation of safer recreational facilities: family and children, health and wellness, community health, and codes and permits. Nationally, the National Recreation and Parks Association, NRPA, whose mission is to advance parks, recreation, and environmental conservation efforts to enhance the quality of life for all people. They would assist with grants and focus on the issues of unsafe parks, look for solutions, and implement them on a national level. Private stakeholders such as land/homeowners would also need to be involved in the planning process, as land would have to be purchased or donated and possibly rezoned. Interventions are the implementation of the assessment and planning stages. Nursing interventions for a safer recreational area would focus on a primary level, such as making sure that the area of the park's playgrounds have soft, spongy ground, such as bark mulch or rubber mulch instead of concrete and asphalt. A lot of the parks in Dover have a lot of asphalt because they have basketball courts and things like that, and there's just a lot of asphalt and very little actual ground turf. This type of ground cover would prevent abrasions and or other serious injuries related to falling on a hard surface. Adequate lighting for each of the areas of the park, to include parking and restrooms, would also be considered primary levels of prevention for physical and environmental safety. A park ranger or community officer being present during operational hours would decrease the likelihood of illegal activity on the premises. A secondary level of prevention would be to continually screen the park for other hazards or potential hazards, such as tree roots poking up while you're walking on the walking trails or the biking trails, damaged facilities, or lack of community policing, like not having a security guard or a park ranger there. Evaluation is the final step in the planning model. Evaluation determines the effectiveness of the project and the interventions. A community level indicator, a CLI, is a measurement guide and determines whether changes have occurred as a result of a particular drive or operation. CLIs could be used to evaluate the expected outcome of the proposed safer community area. Outcome evaluation examines whether changes in knowledge, attitudes, and behaviors did or did not occur as a result of the program. The park ranger or community police officer can assist the community health nurse with this process by logging attendance at the park. If the park is showing an increase in public use, then it could be considered a positive outcome for the project. Also, an online survey or social media would be a useful tool as well. An online survey for social media. A social media survey is a fast and easy method for collecting data about the usage and safety of the park. Questions such as, do the citizens feel safe in the park? What facilities are you using during your time at the park? What other enhancements would you like to see at the park? Open up a comment area for suggestions. The community health nurse would then get a fairly accurate assessment of the project and would be able to report the findings to the community supporters. Section 2, Connected Learning Experiences. Discuss 2 ways that you have connected your NUR 423 review of literature, your CLE for NUR 433, and NUR 433 log work. My review of literature was on physical activity in youth and adolescents. The goal stated by healthypeople.gov is to improve health, fitness, and quality of life through daily physical activity. The physical activity guidelines for Americans, as stated by the CDC, suggest that children ages 6 to 17 should get 60 minutes or more per day of aerobic activity. They suggest that the sustained physical activity level should be moderate or vigorous intensity, at least 3 days a week. Additionally, muscle strengthening and bone strengthening activity should also be included at least 3 days per week. My CLE was at the Calvary Summer Break Camp, where I was able to observe physical activity in youth and adolescents and lack thereof. I observed and logged my findings concerning their outside physical activity and the amount of energy exerted for those activities. During camp, all campers are afforded 1.5 hours of physical activity time each day. Participation is highly encouraged but not mandatory. The findings from my review of literature in relation to the physical activity hours was similar to what I had observed, so I agree with the literature that I reviewed on this point. Another connection of my review of literature to my CLE and log is the area of eating healthy. A recent study from Canada stated that adolescents reported eating approximately 3 lunch or dinner meals prepared away from home, and half of them purchased snacks from vending machines or stores per week. During my CLE, I observed and logged my findings about the dietary habits of the campers. They have to pack their lunch each day as it's not provided by the camp. The younger campers' lunches were packed by their parents, as evidenced by the fruit and vegetables and leftovers being packed, healthier options. The older campers, the 11, 12, 13, 14-year-olds, they stated that they packed their own lunch, and it was very obvious. They tended to pack chips, sodas, Gatorades, sugary snacks, lots of candy. The older campers were not as well monitored during lunchtime. They were kind of left to themselves, so they were able to eat all of their junk food first, and a lot of times their healthier options were actually left back in their lunchbox. Discuss or describe how your NUR 423 and NUR 433 Global Healthcare course contributes to your perspective about a culture of global health. A culture of global health, as stated by the Robert Woods Johnson Foundation, states, our health is inextricably tied to where we live, learn, work, and play. It is shaped by our access to stable housing, quality schools, clean and safe open spaces, and much more. Throughout the global healthcare courses, my mind was open to many disparities concerning health and access to healthy living. I have always believed that healthcare is too costly and that everyone deserves the right to the same types of healthcare, regardless of the ability to pay. I have worked in Capital School District for the past 2 years. It is a Title I school district, meaning they're very, very low socioeconomic status, so they get a lot of government aid. The students are in areas of the city that you just can't even imagine. There are 400 homeless students in the city of Dover. Homeless meaning not living with an actual parent. So that means that they might be living with a grandparent, an aunt, or an uncle, a foster home. There's actually an orphanage called the Murphy House that's in Dover. And then we do have probably about 20 kids that do live on the streets, unfortunately, but 400 total that live in other places besides an actual parent's home. Because of this, the students are afforded free breakfast and free lunch every day during the school year, regardless of their ability or their need to pay, their ability to pay or their need. The schools are quality schools with superior education, and the areas in which these students live doesn't bode well for individual academic success. These kids' homes are being raided in the middle of the night for drugs, and they're being shot. The homes are being shot, and there's always some kind of turmoil going on in inner city Dover. It's mainly 4 streets, but a lot of our students live on those 4 streets. I was in a bubble of my own world. I did the review of literature. I went through town and I did a windshield survey, took some pictures, and everything that I reviewed demonstrates and corroborates the theory that healthcare is linked to living environment. I am now quite aware that I am one of the few very privileged human beings that have been afforded great opportunities to tackle my own healthcare and without restraint. Health promotion and access to healthcare as well as health education is not readily available to all Americans or other countries for that matter. We are truly, truly blessed in this country. Section number 3, analysis and reflections about my continuous and cumulative learning experience throughout my RN to BSN program of study. Excuse me. Present 2 in-depth examples of your integrative learning experiences. Inferential statistics and nurse as a consumer of research are 2 that are very, very closely linked, and they were the 2 classes that I dreaded the most. But they actually complement each other. Statistics is a prereq for NU 343, which is the nurse's consumer of research. I'm not a math person, so having to take statistics was worrisome. I waited really long before I took the class, as long as I possibly could. I dreaded it. Signed up, actually took the class online. Big mistake, huge mistake. I did the course completely online, finished it, passed it. It was very stressful. And I got to thinking, why do I need this? What is this class for? I am never going to use this. And then it became very evident at the beginning of the research class that statistics is integrated into each and every step of the research. It all started to make sense at that point, and I was grateful that I had some knowledge of statistics because it did make the research class a little bit easier. The second example is Nurse as the Teacher and the Global Healthcare Practicum. These are two classes that I've really enjoyed. They focus on the Nurse as the Teacher focuses on the nurse's need to teach their clients and the necessary methods. Learning about the Fry readability scale and the assessment of teaching materials was interesting, and I became acutely aware that sometimes I speak above the level of my patients' heads, which meant that I also wrote that way. I learned how to reword my lessons and my speech so that I could communicate on their level and help them to better understand what I was teaching so that they could learn. It wasn't difficult. I simply needed to be reminded that not everyone has been through nursing school and has the knowledge that we acquire over time. Nurse as a Teacher integrates well into the Global Healthcare Practicum as there's a teaching project embedded in the course. Nurse as a Teacher provided the knowledge and skills necessary for me to be able to write a lesson plan using behavioral objectives and to gauge my lesson wording to the target audience's level. Success is measured at the end of the teaching project when your audience is able to define and describe. My project was dehydration, so I was able to gauge what they learned and how well they learned were they able to define and describe dehydration? Were they able to measure dehydration status by urine color and skin trigger? And then were they able to describe dehydration prevention methods? My audience was captive. They were responsive, and it was a win for Nurse as a Teacher and the Global Healthcare Practicum. The next section is to analyze your transition from your basic RN to BSN level of nursing education. My RN to BSN has taken me over 10 years to complete, and my view of college coursework has not varied much. As a clinically based nurse, I'm a registered nurse first assist. My job revolved around my clinical skills and my abilities. I honestly have never felt that the BSN courses added much to my clinical experience, as I do not want to be in management or a leadership role. Over the last 10 years of classes, I have seen certain courses get reevaluated, dropped, added, and many have increased the requirements, and that's compared to colleagues that have taken the class before me or after me. Nurse as an Educator, because I taught middle school exploring health sciences for the past 2 years, was interesting and useful for the lesson planning and implementation needs. Nurse as a Consumer of Research was out of my scope, as I am not a research-based person. I have a whole new respect for nurses that focus their life on research. I have always had the utmost respect and admiration for those that lead and teach at the higher levels, as well as continuing their education to the master's and doctorate level. I will be using my BSN to retain a school nurse position where I will be in community nursing each day. I will utilize the skills I've gained from Nurse as an Educator, as I have a lesson to teach each year for evaluation purposes. The community health courses that have helped me to better understand the community I will be serving. I have worked in Dover in various areas almost my entire life, but never truly looked at the community through a microscope. It's not a pretty place. I have a better understanding of what my student population has to deal with and the potential reasons they act and react the way that they do. It has been an eye-opening experience for me, and for that I am truly grateful. Verbalize your plan to continue your lifelong learning. I do not feel at this point that I will continue my formal education in the form of a master's degree. However, I will be a lifetime learner, as nurses are in a perpetual loop of education. The technology, medical advancements, and amount and types of research change on a yearly, sometimes monthly basis. In order to be well informed, constant education is necessary. As a school nurse, I will be seeking opportunities to serve my student population with proper education concerning their health issues as well as their home issues. Policies change in alignment with how the needs of the community change. It will be an unending cycle of keeping up to date with the latest and the greatest, so that I may better serve my community, and I am up for the task. Thank you so much. Have a great day.